Welcome to today's lesson. We are talking about the disorder that includes both crashing lows and sky-high mania. So let's kick it off. You probably guessed it. Today we're talking all about bipolar disorder. We're going to start off with a quick practice question. So in this question, which of the following best differentiates between bipolar I and bipolar II? Presence of depressive episodes, presence of psychotic symptoms, presence of full manic episodes, or severity of depressive symptoms? So I just want you to think about this question. By the end, I hope we get our answer. So what are bipolar disorders? The definition: these are mood disorders characterized by both mania and depression. So let's revisit what mania and depression are. Mania is defined as an episode where you have either elevated or irritable mood. Elevated means like super happy, or irritable. And you must have 3 or more DIGFAST symptoms, which we'll talk about in a little bit. And this entire episode must last for 1 week or longer, and it may lead to hospitalization or some form of impairment where you can't function normally everyday life. So the DIGFAST symptoms include being distractible, impulsive, grandiosity, flight of ideas, activity increase, sleep deficit, and talkative. So that's DIG, that's dig, fast if you look at it downward. And I like to think of this guy who's super fixated on digging in this deep hole. He is super energized, doesn't need to sleep, is just super active and trying to dig, and that should remind you of dig fast. And now here, I like to use the Joker from Batman as a cartoon to help me remind what each of these represents. This is not in any way meant to offend anyone or offend people that may have experienced bipolar disorder in their life. It is purely used for educational purposes as a cartoon. So we looked at someone that's distractible. So the Joker is, trying to talk about Gotham or his evil plans and then gets distracted by a puppy. We talk about impulsivity, so people that are bipolar in a manic state might end up doing something super risky or impulsive, go gambling, buy super expensive race cars without having the money, just doing things that are out of the ordinary, that are super risky. They would have grandiosity, so that means that they think they are amazing. They are on top of the world. They are the best. So you can see the Joker, I am the king of Gotham. I'm smarter than Batman. I'm stronger than Superman. I'm funnier than everyone else. You just think super highly of yourself. You might experience a flight of ideas. So this means a flight of idea just means that your thoughts are going to so many different things in your head. Your thoughts are moving super fast from one topic to the next. So the Joker here is saying first balloons, no wait, fish, no clowns, no fireworks. Like your mind is just racing super fast. You have an increase in activity. So the Joker here is just juggling, throwing things around, doing a bunch of things. And in everyday life, this might look like a person that starts a bunch of different house projects and doesn't ever finish any of them. I might go and try to paint my car. Halfway through, I want to start a garden. Halfway through, I decide I'm going to change the roof on my entire house. And then halfway through, I decide that I need to go and do something else. So you're constantly starting new projects and doing a bunch of things. You're just super activity oriented. You have sleep deficit, which means you really don't need to sleep. You could go days on end and still feel super energized without sleeping at all. And then the last thing that kind of goes with flight of ideas is they're super talkative. They will just keep talking to the point where you can't butt in. You can't just say, oh, hi, oh, can I stop you? They just keep going because they have so many racing thoughts in their head. So that is what we cover in terms of DIGFAST and the symptoms of mania. So this is mania, and on the other hand, we have something we call hypomania. So this is still some of these symptoms, but not as many and not as intense. So they might be less intense symptoms. They might last only a couple of days. You don't have any hallucinations, delusions, no psychotic symptoms, and no major impairment. You're still able to function. You're not getting hospitalized. So I like to think of mania as the full big Joker, and then hypomania as maybe a little baby Joker that is sleeping less, might be engaging in some impulsive behavior, but isn't really leading to kind of ruining their life. And now just a reminder, remember that bipolar disorder has mania and depression. And if we revisit depression, that includes a major depressive episode lasting 2 or more weeks with 5+ SIGI CAP symptoms. And this may cause significant distress or impairment in function in our life. So with major depressive disorder, we have to have a depressed mood or anhedonia, which is the inability to feel pleasure. So I can't really enjoy anything in life anymore. Before, I used to enjoy watching movies. Now it doesn't matter what I do, I find no joy. And here we revisit the SIGI CAP symptoms of major depressive disorder. We have a change in our sleep, no interest in doing anything, feeling guilty or worthless, low energy, not able to concentrate, either eating too much or not enough. So we might end up becoming overweight or losing weight. And our body might feel slow and sluggish, or the opposite, restless and agitated. And lastly, we will also see suicidal thoughts. So that is there's many theories out there in terms of what actually causes bipolar disorder, schizophrenia, so on and so forth. But if we talk about the MCAT, the monoamine theory of mood is what you should know about. Monoamines are the neurotransmitters like serotonin and norepinephrine, that go from neuron to neuron. So in depression, we theorize that there is less serotonin and less norepinephrine. And in mania, there's more serotonin, more norepinephrine. So you see this balance. If we have less, then we are leaning towards depression. If we have more, then we're leaning towards mania. And one of the interesting things is in real practice, when I see patients with depression or bipolar disorder, you need to watch out because giving antidepressants to someone who is bipolar may actually trigger hidden mania or mania that you didn't know about in the past. So giving out antidepressants to patients is actually a fine balance, and being able to understand whether they might be predisposed for bipolar and for mania is very important. But anyways, just focus on serotonin, norepinephrine low, likely depression, high, likely mania. And here's a quick cheat sheet. So bipolar 1, you have a full manic episode, a really high high, and then you may also have a really low low, aka depression. Bipolar 2, you have a slightly high. So you have hypomania and you have depression. So a really low depression. So bipolar 1 is really high and really low. Bipolar 2 is slightly high, really low. And then cyclothymia is mild high, mild low. So we have a hypomania and a dysthymia. So not like a full-on depression. So this is a nice cheat sheet to refer to, and when you might get confused about bipolar disorders and depressive disorders. And so we see in bipolar 1, right, really high, we go up on the roller coaster, and then when we swing back down, we have a really deep depression, really low. Now, when we have bipolar 2, remember, we do have a really low, but our high is only a hypomania, so we're only slightly high. And then cyclothymia, we have mild ups and mild downs, so we see hypomania and minor depression, or what we call, dysthymia. So I really like the roller coaster visualization to help me differentiate between these different disorders. And now let's tackle some practice questions. So hopefully by now we can answer this. Which of the following best differentiates bipolar 1 from bipolar 2? And the answer here would be C. That is the presence of full manic episodes, right? In bipolar 1, we have a full manic episode. In bipolar 2, we only have a slight elevation, a hypomania. Now let's look at practice question number 2. A patient reports 4 days of elevated or happy mood, feeling more productive, has less need for sleep, and speaks rapidly. He does not show signs of psychosis or impaired functioning. What is the likely diagnosis? Is it major depressive disorder, cyclothymic disorder, manic, or a hypomanic episode? I'll give you a couple of seconds to think here. And our answer is a hypomanic episode, right? So there is no mention of this patient being depressed whatsoever. Remember, in cyclothymia, you have a hypomania, and then you have a mild depression. Again, there's no mention here of this patient being depressed or down. And then they don't really exhibit a full manic episode because in mania, we have to have the symptoms occur for 1 week or longer, and you have to have impairment of functioning or a hospitalization. So in our case, this is a hypomanic episode. Good work so far. I hope that this has been a helpful lecture. I want you to take away the DIGFAST symptoms for mania. Use that visualization. Think of the Joker. Remember that Bipolar I has a full manic episode. Bipolar II has a hypomania with depression. Cyclothymia is kind of like a mood swing, right? You go up a little bit, down a little bit. You are going hypomania and mild depression. And remember that the MCAT loves neurotransmitters. So remember serotonin, norepinephrine. If they're both high, we have mania. And if they're both low, we likely have depression. Thanks so much for tuning in. Don't forget to follow and subscribe. If this video helped you, hit that like button. Leave us any comments, questions, recommendations, suggestions. And if you want to check out Premed Academy, we focus on community, education, and coaching. See you all next time.